My name is Duncan, and I'm a consultant and a trainer and a faculty member of the Asset-Based Community Development Institute at Northwestern University. Well, I've been here today and yesterday helping train the Wesley nurses on the power of asset-based community development, which is what can we do with what we already have to get what we need or to address our issues, and giving them the tools of asset mapping so that they can go back to their local communities and begin to unlock the amazing resources that are there to help create healthier, safer communities and families in their community. Primarily, their focus has been on doing needs assessments or health assessments that have been focused on what's wrong with a neighborhood or a community, what are the health issues in their community or neighborhood. And through the power of asset mapping, they can begin to look at not only what are those issues, because we need to be aware of them, but what are the resources and the assets, including the gifts and the abilities of individuals in their community that can be used to address those issues. So what it's about is unlocking the resources and power in a community and not just categorizing the problems or issues. The process that we launched today begins with training the Wesley nurses today on the principles and practices and tools of asset-based community development and asset mapping. We've also created a committee of Wesley nurses, and that committee is going to work over the next month and a half to kind of fine-tune what specifically would work best with the Wesley nurses, would work best in the local communities, with the local churches. And then we're going to introduce that plan at the September 11th meeting with both the Wesley nurses and the pastors, and then work to begin to implement the plan that is based on what's going to work best for Wesley nurses and the local churches to unlock the amazing resources that are available in every community in South Texas. I've been doing this kind of work with a number of communities, a number of organizations. I worked with the Maricopa County Health Department to help them launch a similar effort. I've also been working with Metropolitan Health in Austin, or Metro Health in San Antonio, to help them launch this effort. And I've also worked with a number of health foundations that have wanted to, rather than just fund agencies and programs, that wanted to really engage their community so that the community becomes part of the health team and not just the professionals. According to the county health rankings, which is a national ranking of literally every county in this country, the ingredients of creating healthier communities are based for a large part on what the community does, what the residents do. The responsibility for health is only 20% in clinical work. It's 80% what the community can do. So part of this effort is how do we unlock that 80% so we can build healthier communities throughout this country.